Household food insecurity, defined as a lack of money to buy enough healthy foods, is a pressing issue in Alberta. Currently, 1 in 10 households in Alberta experiences food insecurity. Given that 80% of food insecure households receive income through employment, it's clear that this is fundamentally an income-related issue. Evidence indicates that people living in food insecure households are more likely to suffer from chronic conditions such as heart disease, diabetes, and poor mental health. The fact is, food insecurity contributes to poor health, and people with poor health are at a higher risk for food insecurity. As a result, there's a current need for strategies to address the root causes of household food insecurity, which is largely a lack of money to afford basic needs, including healthy foods. With this in mind, the Alberta Policy Coalition for Chronic Disease Prevention and Food for Good came together to chat with community members about household food insecurity and strategies to address this important issue. Here is what community members had to say.
I actually had very little money for many years when I was a single parent. It resulted in a lot of unhealthy food habits and a feeling of deprivation. So I'm living with the consequences of it now, even though I have enough money.
Because you'd sort of expect that the minimum wage would provide for a minimum standard of living.
Because I've been on social assistance and have quite often had to use the food bank, just to make ends meet. And then that costs you money even to go and acquire these services as well.
Household food insecurity has a really large impact in our community. According to census data, people in our target West End neighborhoods earn about 2.5 times less on average than the rest of the city. And people in our neighborhoods are also more likely to live in unaffordable housing, so spending more than 30% of their income on housing. So these factors all contribute to the food security situation in a household. We see a lot of families who are undernourished, relying on processed convenience foods due to lack of income or time or skill, and we kind of say that we're in a food swamp rather than a food desert, because there's healthy food available in grocery stores that's relatively close, but it's not accessible to everyone due to costs and income. And there's an overabundance of cheap processed and fast foods, which are more readily available to residents living in our neighborhoods. And in talking to community members, we've discovered that places like the dollar store are one of the most popular food procurement sites in the West End, which are offering processed, really high in sodium, really high in sugar and fat type foods and nothing fresh. So it does have a huge impact on our community.
I know for me as a director of a human service organization, we support people that are all on AISH and that use social assistance. And I can tell you that each one of those families is food insecure, and they have to make really hard decisions every day. That is, do the kids eat or do I eat? And those are really hard, choices people have to make. And, they try and do the best they can by using great markets like this and the food bank, but it's just not enough to fill those gaps. They are all renters, and they have to worry about rent and cost of living, and there's just a huge gap there. So
government has to look into it. Instead of saying we only have that much money, where else can we get money from? It's allocations. They can keep going into hospital when they are not healthy and they are sick, or we can do some preventive aspects.
There should be a living wage where the bare minimum of what anybody can make is what allows them to live well. And I do think that there are things government can do, like subsidies or programs like this, that allow people to really flourish, I guess.
Well, I just don't even think $15 is enough, really. And I just don't think that policymakers really understand what living on that is, because they're so far removed from that reality altogether.
I think the government does need to step in and look at household income and all of the factors, so much bigger than just charitable organizations.
Right now, communities are left to fill in the gaps, but we need to move beyond community-based responses, and instead, we must address this issue through income-based policy solutions. For example, improving Alberta's benefits and social assistance systems, providing affordable and stable housing, creating a comprehensive poverty reduction strategy, ensuring sufficient income protection for precarious employment, and exploring a guaranteed annual income to make sure everyone can meet their basic needs.
When you're thinking like, what am I going to eat next and how am I going to pay for this food, or you're hungry or malnourished, you can't really reach your full potential. So until everyone in Alberta is taken care of in that respect, our society isn't functioning as high as it could be.